92% of people who die from a cardiac event at night never called for help. Not because they didn't have time, but because they didn't recognize what their body was trying to tell them. What if I told you your heart has been sending you signals for weeks, possibly months, and you've been dismissing every single one of them as something ordinary? I'm Dr. Ming Chen, and I've spent the last 23 years as an interventional cardiologist, which means I'm the doctor who gets the call at 2 in the morning when it's already too late for most people. And after 2 decades of sitting with patients and their families in moments of devastating regret, I made a decision. I was going to start talking loudly about the things that happen in the dark while the world is asleep that kill people who had no idea they were in danger. Today, I'm going to walk you through 5 warning signs your heart sends specifically at night, not during exercise, not during stress at work. At night, while you're resting, while you think you're safe. These are the signals that get missed more than any other, and if you're over 50, this video may be the most important 15 minutes you spend this year. Before I get into the signs, I want you to think about something. You know how a car engine sometimes makes a sound that your mechanic can diagnose immediately? A faint knock, an irregular hum, and you've been driving past it for months thinking it's just road noise? The heart works the same way. It doesn't fail suddenly without warning. It knocks, it hums, it whispers. The tragedy is that most people don't speak the language. Let's change that today. Because once you learn to hear what your heart is saying at night, you cannot unhear it. And that knowledge could be the difference between waking up tomorrow morning and not. Warning sign number 1, waking up breathless for no reason. I want to be precise here because this is not about waking up because it's hot in the room or because you had a vivid dream. I'm talking about jolting awake at 2 or 3 in the morning with a feeling that you cannot get enough air, a feeling that eases when you sit up and gets worse when you lie back down. There's even a medical name for it, paroxysmal nocturnal dyspnea, and it is one of the clearest early indicators of heart failure that we have in clinical medicine. Here's what's actually happening inside your body. When you lie down, the fluid that your weakened heart has been struggling to keep out of your lungs all day shifts. Gravity no longer helps. That fluid accumulates in your pulmonary tissue, your lungs partially flood, and your brain pulls you out of sleep because it's detecting dangerously low oxygen levels. You wake up gasping and you think, strange, must have been the position I was in. And you go back to sleep, and it happens again 3 nights later, and then twice a week. And by the time you mention it to your doctor 6 months from now, your heart function may have declined significantly. A 2019 study published in the Journal of the American College of Cardiology from the Cleveland Clinic found that patients who reported at least 2 episodes of nocturnal breathlessness per month were 3.4 times more likely to receive a heart failure diagnosis within 18 months compared to those who did not, 3.4 times. What should you do? First, note the time and the position. If it consistently resolves when you sit up or prop your pillows, tell your doctor that exact detail. It is diagnostically significant. Second, sleep with your head elevated, 2 or 3 firm pillows, not for comfort, but to reduce fluid redistribution while you sleep. This doesn't fix the underlying problem, but it reduces nighttime episodes while you seek evaluation. And third, schedule a cardiac echo within the next 30 days. Not someday, 30 days. Warning sign number 2, a racing or fluttering heart that wakes you up. I want you to meet Margaret. She was 61, a retired school teacher from Ohio, and when she came to see me, she described it this way. Dr. Chen, I feel like a fish is flopping around inside my chest. It wakes me up maybe once a week. It lasts a minute, maybe 2, and then it stops. I've been too embarrassed to tell anyone because it sounds so ridiculous. Margaret was not ridiculous. Margaret had paroxysmal atrial fibrillation, intermittent AFib, and she'd been living with it undetected for over a year. Here's what concerns me most about nighttime palpitations: the vagal tone, the activity of the nerve that governs your heart rhythm, naturally increases during sleep. For most people, this slows the heart in a healthy way. But for anyone with an underlying arrhythmia, this shift in autonomic balance can actually trigger irregular episodes. So nighttime is paradoxically when certain heart rhythm problems are most active and most dangerous. A fib alone increases your risk of stroke by 5 times. 5. And the cruelest part of paroxysmal AFib is that it may not show up on a standard 12-lead EKG taken in your doctor's office, because by the time you get there, your heart has returned to normal rhythm. The data from a 2021 JAMA Internal Medicine paper out of Stanford showed that in patients over 55 who were symptomatic for palpitations, standard EKG missed paroxysmal AFib in up to 41% of cases. 41%. A wearable heart monitor worn for 2 to 4 weeks changes that completely. If your heart is waking you up at night with fluttering, racing, or a sensation like brief pounding followed by a skipped beat, please ask for an extended cardiac monitor, not just an EKG, an extended monitor. Write that down. Engagement moment, approximately 8 to 10 minutes. Now I want to ask you something directly. Have you ever woken up at night and felt your heart doing something strange, racing, skipping, fluttering, and then just gone back to sleep? If that has happened to you even once in the last 6 months, I want you to type yes in the comments right now, because you are not alone and you deserve to know what to do next. And if you haven't already, please subscribe to the Dr. Ming Chen channel and hit the like button. It tells me that this information is reaching the people who need it most, and it helps me keep making these videos for you. Warning sign number 3. Sweating at night that soaks through your sheets. I know what you're thinking. That's just menopause, or I sleep hot. And sometimes that is exactly what it is. But there is a very specific type of nocturnal sweating associated with cardiovascular disease that has distinct characteristics, and I need you to know the difference. Cardiac-related night sweats tend to be sudden and drenching without any clear thermal trigger. They're often accompanied by one or more of the other signs on this list: mild chest discomfort, an elevated pulse, or a lingering sense of unease you can't quite name. They're particularly common in women with undiagnosed coronary artery disease, which is a tragedy of our medical system because women present with cardiac disease so differently from men that they are systematically undertested and underdiagnosed. Robert, 67, a retired engineer from Arizona, described waking up at 4 in the morning, completely drenched, cold and clammy despite a cool room, with a dull heaviness in his left arm that he'd attributed to sleeping on it wrong for 3 weeks. When he finally came to the ER, not for the sweating or the arm, but because his wife insisted, after a particularly frightening episode, his troponin levels told us he had been experiencing silent myocardial ischemia. His heart muscle was intermittently deprived of blood, silently at night. He was 2 weeks from a significant heart attack. We placed a stent. Today he's coaching his grandson's baseball team. The practical action here is this: keep a note on your phone. Every morning for the next 30 days, spend 30 seconds noting whether you woke up sweating. Include any other sensations you felt. That log, that simple 30-second daily log, could be the most valuable document your cardiologist has ever seen. Warning sign number 4, unexplained jaw, neck, or upper back pain at night. If I had to choose one warning sign on this list that causes the most preventable deaths, it would be this one. Because it is so completely disconnected from what people expect a heart problem to feel like that it gets written off almost 100% of the time. Here's the anatomy. The heart and the jaw, neck, and upper back share nerve pathways that converge in the spinal cord. When the heart is ischemic and when part of it is not receiving adequate blood, the pain signals can travel up these shared pathways and manifest as toothache, jaw soreness, a stiff neck, or an ache between the shoulder blades. This is called referred pain, and it is real, it is physiologically documented, and it kills people who visit their dentist 3 times before anyone thinks to check their heart. The University of Edinburgh published a review in the European Heart Journal in 2020 analyzing 4,200 acute myocardial infarction cases. In 11% of those cases, roughly 1 in 9, jaw or neck pain was the presenting or only symptom. And those patients had a statistically significant delay in receiving treatment compared to patients with classic chest pain. Delayed treatment in a heart attack measurably increases the area of damaged muscle. If you are waking up regularly with jaw tightness, neck discomfort, or upper back aching that has no clear musculoskeletal explanation, no awkward sleeping position to blame, no injury history, and particularly if it comes with any sense of chest pressure, fatigue, or those cold sweats we just talked about, please do not wait. Please don't schedule a massage first. Get your heart checked. Warning sign number 5. Waking up with your heart pounding after a dream, and your pulse stays elevated. Dreams increase heart rate. That's entirely normal. What is not normal is when the elevated heart rate that a dream triggers does not return to baseline within 1 to 2 minutes of waking. And what is profoundly abnormal is when it takes 5, 10, 15 minutes, or when it wakes you because the pounding itself enters your dream and becomes part of it. This sign is closely tied to something called reduced heart rate variability, or HRV, which is essentially your heart's ability to modulate its own rhythm fluidly in response to changing conditions. A heart with good variability accelerates and decelerates smoothly. A heart that is under chronic stress from hypertension, arterial stiffness, or early cardiac disease loses this flexibility. It gets stuck at higher rates. It takes longer to recover. And this loss of variability is now recognized as one of the earliest and most sensitive biomarkers of cardiovascular risk we have. A landmark study from the Pre-Dimed Research Group published in Circulation in 2018, following over 7,000 participants at high cardiovascular risk, found that low nighttime HRV was associated with a 63% increase in the likelihood of a major cardiac event over 5 years. 63%. And the beautiful thing about this sign is that it is measurable. A smartwatch worn consistently will generate an HRV reading. It won't replace clinical evaluation. But if your device is showing you consistently low or declining HRV numbers alongside any of the other signs in this video, that data belongs in a conversation with your cardiologist. So let's put this all together. 5 warning signs your heart is sending you at night. Waking up breathless and it resolves sitting up. A fluttering or racing heartbeat that wakes you. Cold, drenching night sweats without a thermal cause. Jaw, neck, or upper back discomfort with no musculoskeletal explanation. And a heart rate after waking that takes too long to slow back down. None of these signs in isolation is a guarantee that something is wrong. But here is what I need you to understand as clearly as I can say it. If you have 2 or more of these signs occurring even occasionally, the statistical probability that your cardiovascular system is trying to tell you something important is not trivial. It is significant. And I have sat across from too many patients who said, I had all of those, I just didn't know what they meant. I had a patient. Her name was Elena, 58 years old, a translator, sharp as anyone I've ever met, who had 4 of these 5 signs for 7 months. 4 out of 5. She told me she'd looked them up online and scared herself, then convinced herself she was catastrophizing because her blood pressure had always been normal and she exercised regularly. Fit people have heart attacks. Healthy blood pressure doesn't rule out arrhythmia. And being smart doesn't protect you from the information you don't have. Elena is fine. We caught a significant blockage and placed 2 stents. But I think about her every time I record one of these videos because she was 7 months into a conversation her body was screaming at her, and she didn't have the vocabulary to understand it. Now you do. Let me give you your action checklist. These are things you can begin tonight. 1. For the next 30 nights, keep a 30-second morning health log. Note whether you had breathlessness, palpitations, sweating, jaw or neck pain, or slow pulse recovery. Patterns over time are go for a cardiologist. 2. Sleep with your upper body elevated. 2 to 3 firm pillows. This specifically reduces nocturnal fluid redistribution if your heart is under strain. 3. If you have a smartwatch or fitness tracker, activate its HRV or overnight heart rate monitoring feature tonight. Look for downward trends over 2 to 4 weeks. 4. If you experience any combination of these signs more than twice in a month, call your doctor and specifically request an extended cardiac Holter monitor, a basic echocardiogram, and a fasting lipid panel with CRP. Use those exact words. 5. Share this video with one person you love who is over 50. Not because you want to frighten them, because the single most powerful thing you can do for someone's heart health is give them the language to understand what their body is telling them. This is general medical information, and it is not a substitute for evaluation by your personal physician. Every person's cardiovascular history is unique, and I strongly encourage you to bring any of the symptoms we discussed today to your doctor and ask specifically about cardiac evaluation. Please never change or stop any medication without speaking to your healthcare provider. To everyone in the Dr. Ming Chen community, thank you. Thank you for taking your health seriously, for spending these minutes investing in your own well-being, and for sharing this channel with the people around you. If this video helped you, please give it a like. It takes 1 second, and it helps this information reach people who need it. Leave a comment below telling me which of these 5 signs surprised you most, or whether you've experienced any of them. I read every comment. This community is the reason I keep making these videos, and I will see you in the next one.